Hello and welcome to the program. I'm your host here on Health Professional Radio. Thank you for joining us. My name is Neil Howard. I'm going to have a brief conversation this morning with two gentlemen here from ViiV Healthcare and the Latino Commission on AIDS. Now, these two organizations have collaborated on a study to explore strategies to improve healthcare services and HIV treatment adherence for Latino men. Now, the findings from this study were presented in March of this year during a late-breaking session at the Centers for Disease Control and Prevention 2019 National HIV Prevention Conference that was held in Atlanta, Georgia. Now, joining us is Marc Meacham, Head of External Affairs at ViiV Healthcare. He's member of Presidential Advisory Council on HIV/AIDS, and Mr. Guillermo Chacón, President of the Latino Commission on AIDS. They're joining us here to discuss this study and some of the findings. Welcome to the program, both Marc and Guillermo. Thank you for taking the time.
Thank you, Neil.
Thank you. Marc, I mentioned a bit of your background, a brief background, and a little bit of your role there as Head of External Affairs at ViiV.
Yes, and in terms of my experience, I've been working in the field of HIV for over a decade, and ViiV Healthcare is a company that makes HIV medicines. We're 100% focused on HIV. We don't work in any other therapeutic areas. And one of the key things, in addition to making HIV medicines, is really supporting communities and addressing the disparities that we see in HIV in the U.S., particularly along the racial disparities and geographic disparities we see in HIV in the U.S.
Mm-hmm. And Guillermo, a bit of your background, other than being president of the Latino Commission on AIDS.
Basically, as an organization, we are the leader of responding to the impact of HIV among Hispanic Latino communities. And we are proud also to include the U.S. territories, Puerto Rico and the U.S. Virgin Islands.
Now, I understand that the HIV epidemic here in the United States disproportionately affects the Hispanic and Latino population. Is this something that is new, or is this has this been ongoing?
Among minorities, unfortunately, we're the second most impacted. Obviously, the epidemic has been devastating the Black African-American communities, but Latinos in the last few years and in the latest CDC Centers of Disease Control report, and a tremendous increase, especially among gay, bisexual men in the ages of 25, 34, is an alarming new waves of infections. And again, we're very concerned because many of them are focused also in the south of the United States.
Is it of the region of the United States that is it concentrated there in a majorly disproportionate way, Marc?
Well, I think the fact is now with the growth and the mobility in the U.S. that the South is the largest population region in the U.S. But I think there are other factors as well at play there in the South, such as access to care, transportation, a variety of issues that are driving the epidemic there.
Now, in the outset of our conversation, Mr. Chacón mentioned the African-American community as well as the Latin American male community. Are the same factors in the South affecting both of those communities?
I think both communities, confront structural issues, especially stigma and several barriers to access healthcare. Don't forget that throughout the nation, not every state has decided to expand Medicaid, for example, that is designed to meet, especially folks with low income realities. That healthcare is not their top priorities. Other areas that are crucial, but in particular on Latinos, and we're very grateful for ViiV supporting this study in 3 cities, in Los Angeles, Miami, in New York, that look Latinos especially, and I want to highlight to your audience that, when we talk about Hispanic Latinos in the U.S., the issue that we have a lot of foreign-born Latinos and also U.S.-born Latinos, and then the diversity that those segments represent add, to the structural issues that I was mentioning at the beginning, structural issues.
I was just going to add to that I think that another thing is, and why it's critical to have programs like this, is awareness of the safety net that we do have in terms of HIV care in the U.S. So younger people may not have an image of Ryan White and the Ryan White ADAP care program that provides care to low-income people in the U.S. And there, in addition to that, the companies have programs. It can provide free care or reduce out-of-pocket care for costs, but many people are unaware of this HIV safety net that does exist.
Would you say that the lack of awareness is based on the fact that myself, speaking only for myself, and I'm sure that there are others, the HIV fervor, for lack of a better term at the moment, that we saw a decade, 20 years ago, has greatly diminished, when it comes to public service announcements, the posters that you see at your clinics, the billboards and things about HIV, AIDS, and the prevention of that. Why do you think that activity has diminished, although the disease has not?
Yeah, I want to remind, and thank you for that question. I think the reality is that we need truly, to reaffirm or bring back that commitment of visibility and awareness. Unfortunately, we don't have cure for HIV yet. There's a lot of folks working on that. But as to date, we have powerful treatments, and that's good news for the U.S. population and the global population. But truly, we need to reach, every city, every county executive, every governor, and at the highest level. And HHS right now, Health and Human Services, the federal agency in charge to respond to health issues in the United States, is working along with several other partners to put together a plan to, end HIV in America by 2030. But we will need to definitely increase our awareness, especially about the fact about HIV, accessing testing, and those that are HIV positive to immediately access healthcare. I think that's the biggest challenge that we have ahead of us, Neil.
Marc, at ViiV Healthcare, as you said, you're focused totally on HIV treatment, research, and things of that nature. Do you see the research far outrunning the awareness of available programs and cutting-edge discoveries when it comes to HIV/AIDS treatment? Is it just a matter of getting the word out that these treatments are being developed more rapidly than before?
Well, I think it's a number of things. I think one thing that is that people should be aware that we have a standard of care for HIV in the U.S., and that's defined in the DHHS treatment guidelines for HIV. And so, broadly speaking, that standard of care is that people should be diagnosed quickly. Upon diagnosis, people should start treatment that's for the benefit of people living with HIV, but it's also to prevent transmission of HIV. So the science has shown that by being on HIV treatment and being undetectable, having an undetectable viral load, that virtually eliminates transmission to someone who doesn't have HIV. And then there are other things that we're looking at as well as part of the solution. PrEP, there's currently one medicine indicated for the treatment of PrEP in the U.S., and that's certainly an area of research that we're undertaking as well. And there are other things that are being looked at as well. So there's constantly research going on, both for advances in treatment, advances in prevention, and also for people who are living longer and longer with HIV. And so some of the things we're looking at there are actually reducing the number of antiretroviral medicines on board. So we've recently launched two medicines that have two antiretrovirals in them as opposed to three or more. And when you look at the cumulative burden of medicine that people are taking in an aging population, people take medicine for arthritis, cholesterol, all numbers of things. These are other issues that people are thinking about.
Well, we'd like to get some more information about the conference, more about ViiV, and more about the Commission on AIDS, the Latino Commission on AIDS. Where can we go online and get some more information?
Well, for the Latino Commission, it's at www.latinoaids.org, and very, very soon we will be also posting a summary of this study. And
Marc, a little bit more about ViiV. Where can we go online and get some more information about your company?
Sure. So for ViiV, it's ViiVHealthcare.com, and ViiV is spelled ViiV. So it's ViiVHealthcare.com.
Great. Marc Meacham, Guillermo Chacón, thank you both for joining us here on Health Professional Radio this morning. It's been a pleasure, and I'm hoping that we'll have another conversation in the future.
We will. We'll be standing by. Thank you, Neil.
Thank you. Thank you both.
Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.